What are the effects of activation of alpha-adrenergic receptors? There are two alpha-adrenergic receptors, alpha 1 and alpha 2. Alpha 1 adrenergic receptor location, blood vessels. Effect of activation, vasoconstriction. If you see here, normal blood vessels and the constricted one. Pharmacological actions. The vasoconstriction leads to increase in blood pressure as there is increase in peripheral vascular resistance. The drugs that activates the alpha-1 adrenergic receptors are phenylephrine and midodrine. Therapeutic use, phenylephrine used in severe hypotension and shock as intravenous drug because severe hypotension, it's an emergency and we need intravenous drugs. Midodrine is used in the treatment of orthostatic hypotension as an oral drug. Orthostatic hypotension is medical condition where patient's blood pressure drop when they are standing up or sitting down. Or we can say decrease in systolic blood pressure of 20 or more and decrease in diastolic blood pressure 10 or more with standing for 1 minute when compared with the our base value of supine position. Alpha 1 adrenergic receptors located in blood vessels in the nasal mucosa. Activation leads to vasoconstriction. Mechanism includes vasoconstriction of nasal mucosa vessels leads to decrease in edema and decrease in congestion. So decrease in congestion, we need to manage sinus congestion or nasal congestion. The drugs includes phenylephrine, xylometazoline, and pseudoephedrine. For sinus congestion, as an oral medication, we can prescribe phenylephrine and pseudoephedrine. And for nasal congestion in the form of spray, we can prescribe xylometazoline. So vasoconstrictions in the nasal mucosa leads to vasoconstriction that decreases the edema and congestion in the nose. These are the xylometazoline drops for nasal congestion, and phenylephrine we can use in an emergency situation to manage the shock or severe hypotension. Next, alpha-1 adrenergic receptor is located in the radial muscle of the eye. Activation leads to contraction of radial muscle. And this contraction of radial muscle, if you see the image here, These are the radial muscles, and contraction of radial muscles leads to mydriasis, increase in pupil size. Drugs include phenylephrine eye drop, and therapeutic use of phenylephrine eye drops include eye examination and surgical procedure of the eye. So alpha-1 adrenergic receptor activation in the eye leads to radial muscle contraction that leads to mydriasis, increase in pupil size. Next, alpha-1 adrenergic receptor located in the urinary sphincter here, and that leads to the constriction of sphincter. We can say retention of the urine as a pharmacological action. And the drugs that causes retention of urine is midodrine. As we seen, the midodrine is used in the treatment of orthostatic hypotension as an approved drug. But due to use of the midodrine in the management of orthostatic hypotension, the patient may experience urinary retention, especially if the patient has benign prostatic hyperplasia. Next one, alpha-1 adrenergic receptor located in the stomach and sphincter. In the stomach sphincter, it causes the constriction or retention of the sphincter that leads to retention of gastric content. The sphincter here, the retention of gastric content due to activation by the alpha-1 adrenergic receptor. In the intestine, alpha-1 adrenergic receptor decreases the motility and tone. This is also the same effect we can see when there is an activation of beta-2 adrenergic receptor. So alpha-1 and the beta-2 activation leads to decrease in motility and tone in the intestine that leads to the relaxation. This activity is not used in the clinical practice. The drugs that causes or activates the alpha-1 and beta-2 includes adrenaline and noradrenaline. Now alpha-2. Alpha-2 receptor present presynaptically, and when it's present the presynaptically, that controls the release of neurotransmitter that includes adrenaline and noradrenaline. Let us see the pharmacological effect of activation of alpha-2 adrenergic receptors. Alpha-2 adrenergic receptors located presynaptically, presynaptic membrane, And activation of alpha 2 adrenergic receptors leads to reduced sympathetic outflow. It controls the release of neurotransmitters adrenaline and noradrenaline. And pharmacological actions include that it controls the release of neurotransmitter noradrenaline that decreases the blood pressure, and this central activity leads to therapeutic use as treatment of hypertension. And drugs include clonidine and methyldopa. This drug activates the alpha 2 adrenergic receptor located presynaptic membrane, results in reduced sympathetic outflow and decrease in blood pressure. Methyldopa is most commonly used as a second line drug in the management of gestational hypertension, and the first line drug for the gestational hypertension is labetalol. Alpha 2 adrenergic receptor located in the eye. First we seen alpha 1, now alpha 2. What is the effect of activation? Activation of alpha 2 adrenergic receptor in the eye leads to reduces aqueous humor production. And if aqueous humor production is decreased, that leads to meiosis or decrease in pupil size. In contrast to this, if we compare alpha 1 and alpha 2, alpha 1 causes mydriasis, increase in pupil size, while alpha 2 activation leads to meiosis, decrease in pupil size. Examples of drugs: apraclonidine, brimonidine. As it decreases the aqueous humor production, therapeutic use leads to in the management of glaucoma, because in the glaucoma there is increase in intraocular pressure, and we need here meiosis activity that decreases the intraocular pressure and reduces the aqueous humor production as well. So therapeutic use of alpha 2 adrenergic activation in the treatment and management of glaucoma, and inhibition of intraocular pressure, perioperative intraocular pressure before the surgery. To prepare the eye for surgery, we need to decrease intraocular pressure, and we need to give alpha 2 adrenergic receptor agonist, apraclonidine or brimodidine. These are available as eye drop as well. So if we compare between the alpha 1 and alpha 2, alpha 1 adrenergic receptor activation leads to mydriasis, increase in pupil size, and alpha 2 adrenergic receptor activation leads to meiosis, decrease in pupil size. And these are the effects of alpha 1 adrenergic receptor activation. Alpha 1 leads to vasoconstriction, as alpha 1 receptor available in the blood vessels, and vasoconstriction means we can say peripheral vascular resistance will increase, that decrease the blood flow to the tissues, and due to vasoconstriction we can say it's an increases the blood pressure. Alpha 1 receptor available in the eye leads to mydriasis, radial muscles of the eye, and sphincter constriction and urinary retention This is the effect of alpha-1 adrenergic receptor activation. The drug name is midodrine. This midodrine causes the urinary retention if the patient is using for the management of orthostatic hypotension.